Have you ever found yourself wide awake in the dead of night, staring at the ceiling when the rest of the world is sound asleep? Maybe it's 3 a.m., maybe it's a little before or a little after, but that familiar jolt of wakefulness can be frustrating and leave you feeling tired and groggy the next day. If you're like many folks in their 60s and beyond, this might be a recurring experience. You're not alone. It's a really common concern, and it's something we're going to talk about today. We're going to delve into why these nighttime awakenings seem to happen so frequently as we get a little older, specifically that 3 a.m. wake-up call that many of you might be familiar with. More importantly, we're going to explore what this might actually mean for your overall health and the quality of your sleep. Because getting good, restful sleep isn't just about feeling less tired tomorrow. It plays a vital role in so many aspects of our well-being, especially as we navigate these wonderful later years of life. In this video, we'll gently unpack some of the key reasons behind these nighttime interruptions. We'll look at how our sleep patterns naturally shift as we age, and we'll also touch upon some common lifestyle factors and underlying health conditions that can contribute to waking up in the middle of the night. But it's not all doom and gloom, not at all. We'll also discuss practical and actionable steps you can take to try and reclaim those precious hours of sleep and improve your overall sleep quality. We want you to feel empowered with information and equipped with strategies to help you sleep better and feel your best. So, let's settle in and explore this important topic together. One of the first things to really understand is that our sleep isn't just one continuous state of rest. It's actually a cycle of different stages, each with its own unique purpose. Think of it like a carefully orchestrated symphony with different movements. We have light sleep, deep sleep, and REM sleep, which stands for rapid eye movement sleep, the stage where most of our vivid dreaming occurs. This entire cycle typically repeats several times throughout the night. Now, as we gracefully move through the years, the amount of time we spend in each of these stages can naturally shift. Specifically, we tend to spend less time in those deeper, more restorative stages of sleep, particularly stage N3, also known as slow-wave sleep. This deep sleep is incredibly important. It's when our bodies do a lot of their physical repair work, and it plays a crucial role in consolidating memories. Think of it as your brain organizing and filing away the day's experiences. When we don't get enough deep sleep, we might wake up feeling physically unrefreshed, even if we thought we slept for a decent number of hours. Conversely, as we age, we often spend more time in the lighter stages of sleep, stage N1 and stage N2. These stages are, as the name suggests, much lighter, and therefore, we become more easily aroused by external noises, changes in temperature, or even internal bodily sensations. So, that 3 a.m. wake-up might not be due to a specific problem, but rather a natural part of your sleep cycle shifting, making you more susceptible to waking up as you transition between these lighter sleep stages. It's not necessarily a sign that something is drastically wrong, but it can certainly be disruptive and leave you feeling less than your best. Another really significant player in our sleep is our body's internal clock, often referred to as our circadian rhythm. This is like an invisible conductor directing the orchestra of our bodily functions over a roughly 24-hour cycle. It influences not just our sleep-wake patterns but also things like hormone release, body temperature, and even our appetite. Think of it as an internal timekeeper that helps us anticipate the day and night. This internal clock is heavily influenced by external cues, the most powerful of which is light. When our eyes detect light, especially sunlight, it sends signals to a part of the brain that helps to keep our circadian rhythm in sync with the day-night cycle. This prompts us to feel alert during the day and sleepy as darkness falls. Our bodies also produce a hormone called melatonin, which plays a key role in promoting sleepiness, and its release is also regulated by the circadian rhythm. Now, as we age, this internal clock can become a little less robust and its sensitivity to those external cues, particularly light, might change. This can lead to a tendency for our circadian rhythm to shift slightly, often resulting in us feeling sleepy earlier in the evening and waking up earlier in the morning. That familiar 3 a.m. awakening might simply be your body's way of saying it's had its fill of sleep for the night, even if you personally don't feel fully rested and ready to greet the day. It's almost like that internal alarm clock we all have is starting to go off a little too early for our liking. Understanding this natural shift can sometimes make those nighttime awakenings feel a little less alarming. Beyond these natural age-related shifts in our sleep patterns and internal clock, there are a number of lifestyle factors that can significantly contribute to those frustrating nighttime awakenings. Let's take a closer look at some of these common culprits. First up, let's talk about caffeine. For many of us, that morning cup of coffee or afternoon tea is a cherished ritual, and in moderation, it's generally fine. However, as we get a little older, our bodies might process caffeine more slowly than they used to. This means that caffeine can linger in our system for a longer period, potentially interfering with our sleep even if we had our last cup several hours before bedtime. You might be surprised to know that caffeine isn't just in coffee and tea. It can also be found in chocolate, some soft drinks, and even certain over-the-counter medications. Being more mindful of your caffeine intake, especially in the afternoon and evening hours, could make a noticeable difference in your ability to fall asleep and stay asleep through the night. Perhaps try switching to decaffeinated options after lunchtime and see if that helps those 3 a.m. wake-ups become less frequent. Next, let's consider alcohol. Many people find that an evening drink helps them relax and unwind, and it might even initially make you feel drowsy and fall asleep faster. However, the effects of alcohol on sleep are often deceptive. As your body processes the alcohol later in the night, it can actually lead to more fragmented sleep, meaning you're more likely to experience awakenings, including that dreaded 3 a.m. jolt. Alcohol can also suppress REM sleep, that important stage for dreaming and emotional processing. Furthermore, it can relax the muscles in your throat, potentially worsening conditions like sleep apnea and leading to more disrupted breathing and awakenings. So, while an evening cocktail or glass of wine might seem appealing for relaxation, it could be inadvertently contributing to your nighttime sleep problems. Experimenting with reducing or eliminating alcohol in the evenings might be a worthwhile step to improve your sleep quality. Then there's the timing and composition of our evening meals to think about. Eating a large or heavy meal too close to bedtime can put a strain on your digestive system. While your body should be winding down for sleep, it's instead working hard to digest that meal. This digestive activity can lead to discomfort, such as indigestion or heartburn, which can certainly disrupt your sleep cycle and lead to awakenings. Opting for a lighter evening meal a few hours before you plan to go to bed gives your body time to start the digestion process before you lie down. Consider incorporating easily digestible foods and avoiding those that are known to trigger digestive issues for you in the evening. Our daily routines and habits also have a surprisingly profound impact on our sleep. Think about your sleep schedule. Are you going to bed and waking up around the same time each day, even on weekends, or is it more variable? Inconsistent sleep schedules can really throw off your body's natural sleep-wake rhythm. It's like constantly resetting that internal clock, making it harder for your body to know when it's truly time to sleep and time to be awake. Trying to establish a regular sleep schedule, where you aim for roughly the same bedtime and wake-up time every day, can be incredibly helpful in regulating your circadian rhythm and promoting more consistent sleep. Physical activity is generally fantastic for our overall health, boosting our mood and energy levels, and it can also be a great aid in improving sleep quality. However, the timing of your exercise can be important. Engaging in intense physical activity too close to bedtime can actually be stimulating for your body and mind, raising your heart rate and body temperature, which can make it harder to fall asleep and stay asleep. Aiming for regular physical activity earlier in the day, whether it's a brisk walk, some gardening, or a gentle exercise class, allows you to reap the sleep-promoting benefits without disrupting your nighttime rest. Now, let's gently move into the realm of underlying health conditions that can sometimes be at the root of those persistent 3 a.m. awakenings. It's really important for me to emphasize here that I am not a medical professional, and if you have any specific concerns about your health or your sleep, the best course of action is always to consult with your doctor. They can provide personalized advice based on your individual health history. However, being aware of some common conditions that can affect sleep in older adults can be helpful in having informed conversations with your healthcare provider. One very common contributor to nighttime awakenings, particularly the need to get up and go to the bathroom, is a condition called nocturia. This is defined as the need to wake up one or more times during the night to urinate. While occasional nighttime trips to the restroom are normal, frequent nocturia can significantly disrupt your sleep and make it challenging to fall back asleep. This can become more prevalent as we age due to a variety of factors. For example, changes in bladder function can lead to a reduced capacity to hold urine. In men, an enlarged prostate gland can put pressure on the bladder and increase the frequency of urination. Certain medical conditions, such as diabetes or heart failure, can also contribute to nocturia, as can some medications, like diuretics. If you find yourself waking up multiple times a night to urinate, it's definitely worth discussing with your doctor to identify any underlying causes and explore potential management strategies. Simple things like limiting fluid intake a few hours before bed, especially caffeinated and alcoholic beverages, might also help. Another condition that can wreak havoc on nighttime sleep is acid reflux or heartburn, where stomach acid flows back up into the esophagus. This can cause a burning sensation in the chest, as well as other uncomfortable symptoms, which can certainly lead to awakenings during the night. Lying down can sometimes worsen reflux symptoms, as gravity is no longer helping to keep stomach acid down. Being mindful of what you eat and when you eat it, avoiding large or fatty meals and acidic foods close to bedtime, can be helpful. Elevating the head of your bed slightly can also help to reduce nighttime reflux. If you experience frequent nighttime heartburn, over-the-counter antacids or prescription medications might provide relief, but it's important to talk to your doctor about persistent symptoms. Restless leg syndrome, RLS, and periodic limb movement disorder, PLMD, are two related conditions that can significantly disrupt sleep. Restless leg syndrome is characterized by an irresistible urge to move the legs, often accompanied by uncomfortable sensations like tingling, crawling, or aching, particularly in the evening or at night. These sensations are often relieved by movement. Periodic limb movement disorder involves repetitive jerking or twitching of the legs, and sometimes arms, during sleep, which you might not even be aware of but can still disrupt your sleep cycle and lead to awakenings. Both RLS and PLMD can make it very difficult to fall asleep and stay asleep. If you suspect you might have either of these conditions, it's important to seek medical evaluation, as there are various treatment options available, including lifestyle changes, supplements, and medications. Chronic pain conditions, such as arthritis, back pain, or neuropathy, can also be a major obstacle to getting a good night's sleep. Persistent pain can cause significant discomfort, making it difficult to find a comfortable sleeping position and leading to frequent awakenings throughout the night. The pain itself can also be arousing, preventing you from reaching or staying in deeper stages of sleep. Effectively managing your pain through medication, physical therapy, or other recommended strategies is crucial not only for your overall well-being but also for improving your sleep quality. Discussing your pain management plan with your doctor and exploring options for nighttime pain relief might be very beneficial. It's also important to acknowledge the significant impact that mental health conditions like anxiety and depression can have on our sleep. Anxiety can often manifest as racing thoughts, worry, and a feeling of being on edge, making it incredibly difficult to relax and fall asleep. Even if you do manage to fall asleep, anxiety can lead to frequent awakenings during the night as your mind struggles to quiet down. Depression, on the other hand, can present with a variety of sleep disturbances, including insomnia, difficulty falling asleep or staying asleep, early morning awakenings, waking up much earlier than desired and being unable to fall back asleep, and feeling unrefreshed despite sleeping. Addressing underlying mental health concerns through therapy, medication, or other support is often essential for improving sleep. If you're struggling with anxiety or depression, please reach out to a healthcare professional for guidance and support. Furthermore, we need to consider that certain medications can have side effects that directly interfere with our sleep. Many medications can affect sleep patterns, causing insomnia, drowsiness, or nighttime awakenings. If you are taking any prescription or over-the-counter medications, it's definitely worth having a conversation with your doctor or pharmacist about potential side effects and whether any of your medications could be contributing to your nighttime sleep disturbances. There might be alternative medications available or adjustments that can be made to the timing of your doses that could help minimize these sleep-related side effects. Never stop taking a prescribed medication without first consulting your doctor. Finally, sleep apnea is another significant health condition that can lead to frequent nighttime awakenings. Sleep apnea is characterized by repeated pauses in breathing during sleep. These pauses can last for several seconds or even minutes and are often followed by a gasp or snort as breathing resumes. These breathing interruptions disrupt your sleep cycle, often pulling you out of deeper sleep stages and leading to fragmented and unrefreshing sleep. While you might not always be consciously aware of these awakenings, they can contribute to daytime sleepiness, fatigue, and other health problems. If you suspect you or your bed partner notice signs of sleep apnea, such as loud snoring, pauses in breathing during sleep, or excessive daytime sleepiness, it's crucial to get it diagnosed by a doctor. Effective treatments, such as continuous positive airway pressure, CPAP, therapy, are available and can significantly improve sleep quality and overall health. Now that we've explored some of the common reasons why older adults might keep waking up at 3 a.m., it's really important to understand what the implications of these nighttime interruptions can be for your overall health and the quality of your life. Consistent nighttime awakenings and poor sleep quality are more than just an inconvenience. They can have a significant impact on various aspects of your well-being. One of the most immediate and noticeable consequences of poor sleep is, of course, daytime fatigue and sleepiness. When you're constantly waking up during the night and not getting enough restful sleep, you're likely to feel tired and sluggish throughout the day. This can significantly affect your energy levels, making it harder to engage in your usual activities and enjoy your hobbies. It can also impact your ability to concentrate and focus, making tasks that require mental alertness more challenging. That persistent feeling of being drained can really take a toll on your overall quality of life. Beyond just feeling tired, poor sleep can also have a direct impact on your cognitive function. Sleep plays a vital role in consolidating memories and maintaining sharp thinking. When you're not getting enough restful sleep, it can affect your memory, making it harder to recall information. Your attention span might also suffer, and you might find it more difficult to make decisions or solve problems. Prioritizing good sleep is truly an investment in maintaining your cognitive health and keeping your mind sharp as you age. The impact of poor sleep extends to our emotional well-being as well. When we're sleep deprived, we tend to be more irritable and prone to mood swings. Lack of sleep can also increase feelings of anxiety and make it harder to manage stress. In the long term, chronic sleep problems have even been linked to an increased risk of developing symptoms of depression. Getting adequate, restful sleep is crucial for maintaining emotional balance, resilience, and a positive outlook on life. Furthermore, consistent lack of sleep can have tangible physical health consequences. Our immune system relies on adequate sleep to function optimally. Chronic sleep deprivation can weaken your immune system, making you more susceptible to colds, flu, and other infections. Sleep also plays a role in regulating our metabolism, and poor sleep has been linked to an increased risk of weight gain, insulin resistance, and type 2 diabetes. Over time, chronic poor sleep can even contribute to an increased risk of cardiovascular problems. So, as you can see, getting good sleep isn't just about feeling better tomorrow. It's a fundamental pillar of our overall physical health. So, it's abundantly clear that achieving good, restful sleep is absolutely vital for our overall health, our cognitive function, our emotional well-being, and our quality of life, especially as we embrace these wonderful later years. Now, let's shift our focus to the positive and talk about some practical and actionable strategies that you can implement to try and minimize those frustrating nighttime awakenings and improve the overall quality of your sleep. One of the most effective things you can do to promote better sleep is to establish a consistent and relaxing bedtime routine. This routine acts as a signal to your body and mind that it's time to wind down and prepare for sleep. Think of it as creating a gentle transition from your busy day to a state of calm and rest. Your bedtime routine could include a variety of calming activities that you find enjoyable and relaxing. Perhaps you could take a warm bath or shower, which can help to relax your muscles and lower your body temperature, both of which are conducive to sleep. Reading a physical book, avoiding screens at this time, can be a wonderful way to quiet your mind. Listening to calming music, nature sounds, or a soothing podcast can also be very effective. Gentle stretching exercises or a few minutes of quiet meditation can help to release tension and promote relaxation. The key is to choose activities that help you feel calm and peaceful. It's also important to be consistent with your bedtime routine, performing the same or similar activities each night to further strengthen the signal to your body that it's time to sleep. Avoid engaging in stimulating activities right before bed, such as watching exciting or suspenseful TV shows or engaging in intense or emotionally charged discussions. Creating a sleep environment that is conducive to rest is also absolutely crucial. Think of your bedroom as your sleep sanctuary. Ideally, it should be dark, quiet, and cool. Darkness signals to your brain that it's time to produce melatonin, the sleep hormone. Consider using blackout curtains to block out any external light. Noise can be incredibly disruptive to sleep, so if you live in a noisy environment, earplugs or a white noise machine might be helpful in masking distracting sounds. Temperature also plays a significant role in sleep. Most people sleep best in a slightly cool room, typically between 60 and 67 degrees Fahrenheit, around 15 to 19 degrees Celsius. Finally, ensure that your mattress and pillows are comfortable and provide adequate support for your body. An uncomfortable bed can lead to aches and pains that disrupt your sleep. Being mindful of your exposure to light throughout the day and evening is also incredibly important for regulating your circadian rhythm. Natural light, especially bright sunlight in the morning, helps to set your body's internal clock and promotes alertness during the day. Try to get some sunlight exposure early in the day, perhaps by taking a walk outdoors or simply sitting by a window. Conversely, it's crucial to minimize your exposure to bright artificial light, especially the blue light emitted from electronic devices like smartphones, tablets, and computers, in the hours leading up to bedtime. Blue light can suppress melatonin production and make it harder to fall asleep. If you do use screens in the evening, consider using blue light filters on your devices or wearing blue light blocking glasses. Aim to power down your electronics at least an hour or two before you plan to go to sleep. As we discussed earlier, what and when you eat and drink, particularly in the evening, can significantly impact your sleep. Continue to be mindful of avoiding large meals, caffeine, and alcohol close to bedtime. If you find yourself feeling hungry in the evening, opt for a light, easily digestible snack rather than a heavy meal. Some good options might include a small bowl of yogurt, a few whole wheat crackers with cheese, or a piece of fruit. Stay hydrated throughout the day, but try to limit your fluid intake in the 2 to 3 hours before bed to minimize nighttime trips to the bathroom. We've also touched on the benefits of regular exercise for sleep, but it's worth reiterating the importance of timing. Aim for regular physical activity most days of the week, but try to avoid strenuous workouts within 3 to 4 hours of bedtime. Exercising earlier in the day can help to improve sleep quality without disrupting your ability to fall asleep at night. Even gentle activities like walking, swimming, or gardening can have a positive impact on your sleep over time. Managing stress and anxiety is absolutely key for achieving restful sleep. If your mind is racing with worries and to-do lists at night, it can be very difficult to relax and fall asleep, and it can also contribute to nighttime awakenings. Explore relaxation techniques that you find helpful, such as deep breathing exercises, mindfulness meditation, or progressive muscle relaxation. There are many guided meditation apps and resources available that can help you learn and practice these techniques. Engaging in calming hobbies in the evening, like knitting, reading, or listening to music, can also help to reduce stress and prepare you for sleep. If stress or anxiety is a persistent and significant issue for you, please consider talking to a healthcare professional about potential coping strategies, therapy options, or other resources that can provide support. If you consistently find yourself waking up at 3 a.m. or any other time in the middle of the night and struggling to fall back asleep, a helpful strategy can be to get out of bed and go to another room. Engage in a quiet and relaxing activity in dim light until you start to feel sleepy again. This could be reading a book, not on a screen, listening to a calming podcast, or doing some gentle stretching. Avoid staying in bed tossing and turning, as this can create a negative association between your bed and being awake and frustrated, making it even harder to fall asleep when you do get back in. Only return to bed when you feel genuinely sleepy. It's also really important to be patient and consistent when implementing these strategies. It might take some time for your body to adjust to new routines and for you to see noticeable improvements in your sleep. Don't get discouraged if you don't experience immediate results. Stick with these healthy sleep habits, and over time, you're likely to see a positive impact on your sleep quality. Finally, I want to reiterate that if your sleep problems persist, are severe, or are significantly impacting your daily life and well-being, it is definitely a good idea to talk to your doctor. They can help to rule out any underlying medical conditions that might be contributing to your nighttime awakenings and can recommend appropriate treatment options tailored to your specific needs. They might also suggest a sleep study, which is a non-invasive test that monitors your sleep patterns overnight to get a more detailed understanding of what might be happening. Don't hesitate to seek professional help if you're concerned about your sleep. Remember, prioritizing your sleep is not a luxury. It's a fundamental act of self-care. It's an essential investment in your overall health, your cognitive function, your emotional well-being, and your ability to enjoy a full and active life during these wonderful years. By understanding the potential reasons behind those nighttime awakenings and by implementing some healthy and consistent sleep habits, you can absolutely work towards reclaiming those precious hours of rest and waking up feeling more energized, refreshed, and ready to embrace the day. It's also worth keeping in mind that occasional brief awakenings during the night are a normal part of the sleep cycle for everyone, and this can become slightly more frequent as we age. The key difference is whether you are able to fall back asleep relatively easily and whether these awakenings are significantly disrupting your overall sleep and impacting your daytime functioning. If you wake up for a few minutes in the night and then drift back to sleep without much conscious thought or struggle, it's likely not something to be overly concerned about. Think of cultivating good sleep as a skill, something that we can all learn and improve upon with consistent effort and attention. Just like any other aspect of our health, it requires us to be mindful of our habits and to address any underlying issues that might be getting in the way. By being proactive and implementing some of the strategies we've discussed today, you can often significantly enhance the quality and duration of your sleep. So, the next time you find yourself staring at the ceiling at 3 a.m., try to take a deep breath and remember that you are not alone in this experience. Know that there are many things you can do to help improve your sleep. Start by focusing on creating a relaxing and consistent bedtime routine, optimizing your sleep environment to be dark, quiet, and cool, and being more mindful of your lifestyle choices, particularly when it comes to caffeine, alcohol, and evening meals. Remember that even small, consistent changes to your habits can often lead to significant and lasting improvements in your sleep quality over time. Be patient and kind to yourself throughout this process, and celebrate the small victories as you start to experience more restful nights. Each night that you prioritize good sleep is a step forward towards better overall health and well-being. I truly hope that this video has provided you with some valuable insights and practical tips that you can start to implement. Now, I would absolutely love to hear from you. Do you often find yourself waking up in the middle of the night? What are some of the strategies that you have personally found helpful in improving your sleep? Please share your experiences and thoughts in the comment section below. Your insights could be incredibly valuable and supportive to others in our wonderful community who might be facing similar challenges. If you found the information in this video helpful, please consider giving it a like. And if you would like to see more content like this, focusing on various aspects of health and well-being as we navigate these important and fulfilling later years of life, please consider subscribing to the channel. We have lots more helpful information and encouraging content coming your way. Thank you so very much for spending this time with me today. Here's to many more nights filled with deep, restful, and rejuvenating sleep, and to living your very best life at any age. Sweet dreams and take good care.